Hi, I'm Cassie. And I'm Brianna.
And I'm Dylan. And our drug is Finasteride.
This is Finasteride News.
Good morning. Today we're going to be talking about the drug finasteride, and I have Dylan here to answer a couple questions for me. Hi Dylan, how are you today?
I'm good. How are you?
Good. Okay, I'm glad to hear that. So I have a couple questions. So is this drug, is finasteride FDA approved?
Yes, it is.
Okay, so that's good to know. What year was it approved in?
I believe it was in 1992.
Okay, that's interesting. So, can it be used over a long period of time, or is it just short uses?
So this drug can be used for a long period of time, and it seems to be more effective if it's used multiple times.
Okay, that's interesting. So what are some complications since it's used for long term?
So some side effects are a decreased sexual desire or mood alterations. So
Okay.
depression can be a result of that.
Okay, so Cassie, do you have anything to add on that?
Yeah, I actually do have something to add. I was doing some research while you guys were talking and found that a study showed from 61 participants in 2011 that based on the Beck Depression Scale, 14 indicated mild depression, 20 indicated moderate depression, and 29 was severe depression, reported with prolonged sexual dysfunction. 39% reported suicidal thoughts. Okay, so back to you, Brianna and Dylan. Go.
So Brianna, our viewers have submitted some questions after that last segment. The first one I want to ask you is, what is the brand names and trade names of this drug? We all know the generic name is Finasterides.
Okay, so the two I know of are Propecia and Proscar. Those are the only two that I'm aware of right now.
Okay, another question was, what is the action of this drug?
So finasteride is administered because an enzyme called 5-alpha reductase will change the testosterone in the body to another hormone. So when it does that, that will actually cause the prostate to grow and enlarge and for hair to be lost off of the scalp. So when you administer this drug, it will increase the testosterone levels in the body, which will then cause the prostate size to decrease and hair growth will then be stimulated. And what is actually causing all of this is the prostate, which is walnut-sized in the male human body.
Well then, moving on. So another question that one of our viewers submitted was, what are some of the therapeutic classifications?
So its therapeutic classification is actually a hair growth stimulant because it allows the testosterone levels in the body to increase.
We'll be happy with that answer. The next one is, what are some of the pharmacologic classes?
It is known as an androgen inhibitor, and what that it's also known as an androgen antagonist or a testosterone blocker. So what that does is it will either slow down or completely stop the growth of cancer cells within the prostate to treat prostate cancer. And it will also reduce the androgen signalings within the tissues that are found in the prostate or in the scalp. And that will reduce the prostate volume and reduce then the loss of hair.
So generally at this time, I'd like to take some phone calls from our viewers, see if they have any questions.
Dylan, we have a phone call for you from one of our viewers.
Okay. So the viewer is asking some of the side effects and adverse effects of this drug. They were kind of worried about it because I guess one of their family members are currently taking this drug. Could you help them out with that?
Okay, so side effects, one of the biggest one is actually gynecomastia, which that is the enlargement of male breasts because of the hormone imbalance whenever you take this drug. But others include a decreased sexual desire, a decreased sperm production, erectile dysfunction, infertility, breast cancer, and also angioedema, which is the swelling in the deep layers of the tissue. But the adverse reaction is actually, it can cause prostate cancer instead of reducing the risk of getting that prostate cancer in the male.
Good. So after a word from our sponsors and a commercial, we'll be back with Cassie and Bree for more information.
Okay, so now that we're back from our break, we have Cassie here to answer some questions for us that were submitted by the viewers. So the first question is, what would you assess for in a patient who had just recently started taking finasteride?
Well, the patient should have a urologic evaluation before starting finasteride.
Okay, Okay, so why is that? Why do they need that?
That's because sometimes the prostate's enlarged and they'll have trouble urinating.
Oh, okay. So what are some other things you might assess with that?
Well, it's common to use digital rectal examinations before and during drug therapy to assess for changes. Also, assess before and during therapy for symptoms of prostatic hyperplasia.
And what is that? What's prostatic hyperplasia?
That is an increase in the amount of organic tissue that results from rapid cell reproduction. Prostatic hyperplasia is age-associated prostate gland enlargement that can cause urinating difficulties.
Okay.
You would also assess for urinating hesitancy, feeling of incomplete bladder emptying, interruption of urinary stream, terminal urinary dribbling, straining flow, dysuria, which is discomfort and pain while urinating, and urgency.
Okay. So all of those things would happen because of the enlarged prostate?
Yes, and the drug finasteride could have effects.
And that could help. Okay, so you have to reassess after you administer the drug. So when would that take place, and what sort of things would you be looking for when you reassess?
So reassessment would need to take place 3 to 6 months after starting for finasteride to see its effects on hair growth, because shedding has to happen for the hair regrowth to take place. So they will lose their hair before the new hair grows back in.
Okay, so that's interesting. So we actually have some pictures to show you the proof that it really does 100% work.
Yes, so this is a before and after of Dylan. The before, obviously, you can see that he doesn't have any hair, and the after, taking finasteride, the hair is regrowing.
So now that we've seen the drug and it actually works, we're going to take a look at some dosages for it. So we know that it's administered orally because it comes in tablet form. So what are some dosages that you would give for this particular drug?
Okay, so for prostatic hyperplasia, the dosage is 5 milligrams once daily of Proscar. For androgenetic alopecia, the dosage is 1 milligram once daily of Propecia.
Okay, so is it different because of the trade names? They have different dosages for each?
Yes, that is correct.
Okay, so then one last thing I have to ask, are there any specific lab values that should be taken into consideration that should be looked at?
Yeah, finasteride could decrease serum prostate-specific antigen concentrations, which are used to screen for prostate cancer.
Okay, sounds good. So after this next little break, we'll have Dylan come on and he'll answer some questions for us that were submitted by the viewers.
Okay, now we're back with Dylan. He's going to answer some questions for us. Okay, Dylan, when would you administer finasteride?
So finasteride can be administered with or without meals, and it can be administered usually once daily. But a provider needs to be careful because Proscar, the brand name, can be confused with Prograf or Provera. Prograf is for transplant patients that prevents the rejection of those organs, and Provera is for sleep apnea. Pregnant women need to be careful when handling crushed finasteride due to the side effects that it has, and these are within ages of childbearing ages and if they're pregnant.
Good to know. So what would the nurse feel is most important for the patient to know?
I'm glad you asked. I wrote those down. So the patient needs to continue to take finasteride even if their symptoms improve or become unchanged. And 6 to 12 months after therapy, it may be necessary to determine whether or not the individual will respond to finasteride. And the patient needs to notify a healthcare professional if it changes in breast, there are any lumps, pains, or any change in their discharge. And male patients are at increased risk for high-grade prostate cancer while taking this drug. They need to caution a patient that finasteride poses a risk to a male fetus, and emphasize the importance of periodic follow-up exams to a clinical provider for a response that has occurred.
Okay, now are there any dietary restrictions while taking finasteride?
There's not many, but it can be taken with or without food, as I mentioned earlier, and it can interact with heavy alcohol consumption, so if you're going out on them Friday nights, cut back a little bit. And there are no restrictions to dairy products.
Okay.
I'm Dylan.
I'm Brianna.
Brianna.
I'm Cassie.
And
Thanks for watching.
Finasteride News.